I'm Dr. Eddie Simpser, President and CEO at St. Mary's Healthcare System for Children. I'm often asked why we're so worried about our kids at St. Mary's amid this COVID-19 crisis. And while the data suggests that otherwise healthy children do very, very well with this virus, frankly, even better than they do with the flu and other severe viruses, the kids that we take care of here at St. Mary's are quite unique. We're taking care of children with complex medical problems. They have underlying lung disease, heart disease, or complications of prematurity, neurological disorders, all of those kind of things that put them at much higher risk than an otherwise healthy child. And even though there isn't a lot of data right now about the population of children St. Mary's cares for, we're very concerned about them because we see how they react to other viral illnesses, such as the flu, respiratory syncytial virus, parainfluenza, rhinovirus, where they often get very sick and end up sometimes in pediatric intensive care units. And so our concern is that with COVID-19, it will be the same, and they will end up in pediatric intensive care units and have life-threatening illness associated with it. So what is St. Mary's doing about this? Well, we actually have a long-standing experience and expertise in infection control practices within pediatric post-acute facilities. For over 20 years now, we've been practicing state-of-the-art infection control, trying to protect our kids from all the viruses and all the bacteria that are out there in the world. And we have a wonderful track record. And we've brought that experience to bear right now during this COVID-19 crisis. We are limiting traffic within our building to minimize risk for our staff and our children. Everyone is wearing masks when they come in contact with our kids, no exceptions. Everyone is being screened before they walk into our building, not just for travel, not just for symptoms, but even we're checking their temperature before they get past our lobby and near our children. And we've employed over the last few years some state-of-the-art technology that virtually no other facilities have to try to control infections. A little over a year ago, we put in a secure air filtration system in our HVAC to filter all the air that's coming into our building and decreasing particles, viruses, and bacteria that are in our air. We are using UV light to disinfect our patient rooms to try to keep them healthier. And most recently, we are starting to initiate a Vitality program, which is a wristband that our staff wear that reminds them to wash their hands and also gives them feedback about their hand hygiene techniques so that we can get the best possible hand hygiene, which we know is the best way to avoid infections in our kids. I want to take this opportunity to thank our heroic staff for all their efforts. They've been working day and night on making sure that our kids, our families, and each other stay healthy. And I also want to thank all of our partners out there for their support. These are trying times, but we will get through this together.